people have this understanding of what addiction or what a mental health illness looks like, portrayed by something that may not be realistic. And so really breaking down that stigma and that shame and allowing people to know that there is help out there, and that recovery is possible. And, there's living proof every day of it.
Welcome to the Idaho Behavioral Health Authority podcast. In this episode, we talk with experts who take us on a deep dive into the 2023 Governor's Report. Welcome, everyone, to the Idaho Behavioral Health Authority podcast. We're kicking things off by just trying to get a better understanding of what's happening in our state within the realm of behavioral health. And there's really no better place to start than this year's Governor's Report that just recently came out. And Jenny, please introduce yourself.
My name is Jenny Teigen. I serve as the current chair of the Idaho Behavioral Health Planning Council, and I represent the substance use disorder consumer population.
Great. How about you, Kimberly?
I'm Kim Hokinson. Please call me Kim. I know Kimberly's a mouthful, and I represent a parent of consumers of the behavioral health system.
Awesome. Thank you for being here and sharing your time and your knowledge on this. I'm going to let Dustin kick it off with some questions.
The first question is kind of broad. It just asks, what is the Idaho State Behavioral Health Planning Council, and how does it work with the Division of Behavioral Health?
So I'll tackle that first. Hand at that a little bit. The Behavioral Health Planning Council is both a federally mandated and state mandated council that oversees and helps to identify needs and gaps within the behavioral health system that the block grant funds from SAMHSA can address. It's built or made up of consumer members and also consumer stakeholders and also agency stakeholders, such as Department of Behavioral Health, members from the judicial parties, from juvenile justice, from adult corrections, just a lot of different entities that can help us to pinpoint where we need to put funding and money and resources towards to better help the Idahoans that are part of the vulnerable population that need behavioral health services.
Do you have anything you want to add to that, Kim?
No, I think Jenny did a great job. I think I would just add that the Planning Council on the federal side is required as long as the state of Idaho accepts the mental health block grant dollars.
Gotcha. Kim, I'm going to give you a first shot at this question too, but I thought this was kind of interesting. The very first page, the Governor's Report is just kind of starting at the very, very beginning, actually technically page 3, but it starts talking about recovery. Now, we all have an idea of what that means to us, but that definition could change depending on the situation, and the idea of that recovery and the model, or the recovery model of care. What is that? What will you unpack all that for us? One of the things in there I noted, and I have you talk to this specifically, is that recovery within behavioral health. They clearly says it's not like recovering from a sickness. It's not like I got sick and now I recovered. I'm much better. I can go back to work now. That this is actually a lifelong process. Please speak to that and unpack what that means and what we should take from it.
Sure. Yeah. So recovery on the behavioral health side, I think it really differs when you're talking to the different types of stakeholders present, right? We have the consumers, we have the family members and friends of those consumers. And really what it would mean for me and my family, especially as people that directly access those services, is that it's more along the lines of accepting and realizing that, yes, my children do have mental health issues. They do have mental illness. And the stigma needs to reach beyond what it has historically been. They are who they are. They didn't ask to be born with a mental health illness. So it's more about accessing as many services and supports as possible so that they can move forward and be productive and healthy in their lifestyle and within their family, community, social, whatever aspect of their lives, regardless of struggling with their mental illness. And so
Gotcha.
really trying to recover from the stigma and the, I guess it would be more access issues that we've historically seen.
Gotcha. Do you want to add anything to that, Jenny?
No. I think the only thing that I could add is, recovery definitely, I think the meaning of recovery has come a long way in the last 10 years. And which is very, very happy for me to see, because it means that we're moving forward and we are helping a lot more individuals to break through the barriers, to be able to change their lives in a positive manner. I think that is often one of the barriers to recovery, is that people have this understanding of what addiction or what a mental health illness looks like, portrayed by something that may not be realistic. And so really breaking down that stigma and that shame and allowing people to know that there is help out there, and that recovery is possible, and there's living proof every day of it.
I recently listened to a podcast talking about this very subject and whether someone can recover, and they talked and the person who's being interviewed talked about, we have this image of this mentally incapable person sitting there, catatonic, drooling. You kind of paint that picture, and it's never that simple. It's always far more complicated, and you can have someone alert and oriented and aware of what's going on and still be incapable. And I think that definition gets really tricky, whether it's in terms of recovery and how do we get them back to a place of sustainability, right? It's interesting.
You talk about recovery. That's a very important part about substance use disorder. It's going to lead us into our next segment. When we were going through the report, we noticed in the news and stuff, we hear a lot about narcotics. You hear a lot about fentanyl. The state legislature is currently trying to pass a law that would increase penalties for fentanyl possession. But we noticed also that alcohol was the most listed primary substance use by people in Idaho. And we're just wondering why is alcohol not as mentioned in the news? Is it because it's less stigmatized, because it's legal? And is alcohol the biggest issue in Idaho?
So, trend-wise, I don't believe that it has ever gone as a non-popular trend as far as teenage and adolescent consumption. I know that when we have done reports through different prevention agencies and programs throughout Idaho, that has always been one of the biggest concerns. Sorry about the background noise. But I also feel like this does go to a lot to stigma and a lot to the part that I think consumerism plays in the role of drugs and alcohol being a drug. I think that there's a lot of good literature out there about just kind of different people's opinions about why alcohol isn't necessarily highlighted in this concerned fashion. And I think it's a little bit disheartening to me because alcohol is one of the drugs that you can die from withdrawals. And so the severity that somebody has when they're trying to withdraw or trying to get help with something like that, it becomes a really scary thing. And I think that we deal with alcohol the same way that we have in the past with tobacco use. It's advertised. It's one of those first things that you see when you go to a gas station. It's marketed really well, and I think that that's something that society has to change. And I think that the more that we want to advocate for those changes and to identify different healthy things that individuals can do, instead of going out and drinking, finding different prevention programs to enlist our children in and our younger generation, to so then they have better coping mechanisms and and different strengths and resilient factors, so they're not going down this road and thinking that that's their only way to have fun. But that's my own personal opinion. And like I said, there's a lot of literature out there that discusses just these very facts. So
I'm wondering
Interesting.
if you have any perspective from that parent's perspective, to keep youth away from issues like this, from drugs in general. I noticed that there is literature out there talking about how teenagers and youth who do use drugs and alcohol tend to have mental health issues as they age. What are some answers for this? We know that there's gaps and needs that are shown in the report, but what are some answers? What can we do to stem this?
If had those answers, then a lot of issues within Idaho would be resolved. It's difficult, I think, that from a parent's perspective, especially one that very open with my kids. A lot of it has to do with accessibility, quite frankly. Not all families across Idaho, especially when we're talking about rural areas, have access to any type of programs that would allow them to exert that energy or an outlet for them to fill that time, right? So there's not those after school programs. They don't necessarily have the money to be entering into extracurricular activities or even go skiing, which is a pretty popular thing here in Idaho because we have so much snow. And so what is accessible, right, to them? What's accessible is alcohol, unfortunately, things like alcohol, tobacco. It's much cheaper for them to go buy a pack of cigarettes or some cheap beer than it is for them to try to get access into any type of skiing program or any non-existent after school programs, and so they have to pay for things like football, and they have to pay for things like soccer and indoor soccer and ice skating, which are all costly programs for them to enter into. And so unfortunately, I think with all of the experience I have assisting with other families, I do see that it comes down to accessibility for those kids to not have anything accessible to fill that time.
Well, that kind of leads me to wonder, what is the biggest gap within our behavioral health care system? Is it necessarily the lack of services, or is it the lack of opportunity, like you're saying, for kids to, I mean, we're all human, we get bored, we need to do something. And if we don't have the option to do something constructive or positive, we may end up doing what's left over. What is the biggest need in this behavioral health care system from end to end?
I almost feel like that's the chicken and the egg question, and that there is not really a good answer for that because, I do have a child with an SED as well. So she's first started exhibiting behaviors when she was 3 years old. And it wasn't, she does receive services, and she does participate in after school programs, but the access is still there. The boredom is still there. The frustrations within, just different programs, like athletic programs, them not understanding her diagnosis and not understanding how to best help her and build her to be a resilient little human being. Sometimes that frustration is there and it's very real for her. And, as a parent, we have to kind of navigate that system, and it's a little bit different. But I think in rural areas, that is a huge barrier because there are just very, very limited things. And I think that when you get into those rural areas as well, there's a different idea about fun. I grew up in a really small town, and it was a different thing that you did on Friday night than when you moved to Boise and you have all of these different activities that are free and at low cost. And driving out on their old dirt roads was fun to us, and so I think that as generations are getting older and as we're becoming more educated, we are changing the way that we are showing our children fun and good positive interactions and amazing programs that are out there now. So I think that we're coming a long way, but I think that we still have a ways to go. And I think that without having these prevention programs and these good, positive, resilient factors in our children's lives, that would be a deficit. But also, if we lost any of the services in between that to youth crisis services, then we wouldn't be able to help the children that are in those situations. And then it would just be this never-ending cycle that we just don't get out of, it seems like.
Yeah, and I would just add that early intervention is a huge key piece to this. If we look at the developmental disability arena side of the system, they do actually have numerous early intervention programs for children with developmental disabilities. Now, if we applied that same type of philosophy on the behavioral health side, I think that we would see significant progress in this model of care or recovery piece that we're talking about, which I still, kind of view as a philosophy, because until everybody has that buy-in, it is a philosophy. So with that being said, if we look at the behavioral health system as it stands right now, there's very few services available to kids that are 12 years old or younger. Right now, my 10-year-old can only access counseling services, even though he has a serious emotional disturbance, which is completely inappropriate for someone that has a level of need that he does, right? But if he had multiple supports in place and services that were appropriate for his age group and addressed his mental health needs, then we'd be looking at this early intervention piece that could completely changed the trajectory of his life.
You mentioned that rural urban divide. That's something we have a lot of in Idaho. We tend to focus a lot of government things on Ada County and Boise and the things that surround us here. But Idaho is filled with frontier and rural areas. And I think that's one of the best things I get as the takeaway from the governor's report is we focus on all 7 regions. We go through and we ask those big questions. What do you need? What are you doing? And they all list these gaps and needs, and they're all very similar. And I'm wondering, is that the most important part of this report, is to show that even though we've got these differences, that we all still have a lot of the same issues that face all the people across the state?
I would say yes. I can tell you that I live in Region 7, and we are very robust comparatively across the state, but we still have significant access issues even here in 7. 7 is big enough that we have one hub, which is Idaho Falls area, and then the rest is extremely rural. I assist a lot of families in my same region that just don't have that access. And it is an issue. And it is nice to see within the regional behavioral health boards that come back and report with those gaps and needs. It's comprised of members from all over their region. So it's not just people specifically in Boise attending Region 4's behavioral health board. It's not just people in Idaho Falls attending that regional behavioral health board. We're able to capture the voices of people in really rural areas and really hear what it is that they have to say. Because it's one thing for me to say, hey, I can't access services, but it's another for me to explain why I can't access those services. And being able to hear someone walk through exactly what the process looks like for them, living in St. Anthony is eye-opening. It really is.
Do you
I
have
wonder if
anything you want to add to that, Jenny?
No, I think Kim spoke to that really, really eloquently. And, you know, I think that one other really important thing, though, to note on the governor's report is also, and in some of like the region behavioral health boards, they have leadership calls that the planning council partakes in as well, and it allows us to kind of bounce ideas off of each other and find different solutions that might fit in one region that doesn't fit that has been working in another. But I think it's also a really good way for us to thank the governor and the legislator for the work that they are doing, because 5 years ago, some of these things, some of these moving pieces that we have moving right now weren't even a thing. And I think us continuing to note that we notice that they're making progress, that they're trying to help us, that they're trying to help every Idahoan access care and to live their best life. I think that that's really important too.
Awesome. Thank you for sharing that. I think the last big thing, just very, very high level, anyone who reads this report, anyone who hears about this report, what are a couple takeaway messages that you hope people will get from this?
Oh man, I would say that I hope if it says anything that it shows them that their voices matter, right? This is comprised of stakeholders across the state within each region, providing their insight and experiences and stories. And we have compiled that into an entire report that we submit to not only the governor's office, but we do actually put it in the hands of our legislators. And we attempt to do that before sessions. But there has been progress made that has been noted in the history of the governor's reports, because in 2016 and 2017, a lot of the governor's report really was comprised of this cry for help for the adult mental health system. There was nothing in place. And then in 2018, we get the Medicaid expansion put in place, and you can start to see the trends shifting within each year of the governor's report because of Medicaid expansion and how the significant impacts that it has had for our communities across the state. And then we see the implementation of the crisis reports, the crisis center reports, right? Those are huge. That is a huge lift for the state of Idaho. Now we're implementing youth crisis centers. And so we're going to continue to see this trend of pretty much Idahoans telling them, hey, thank you for this. This is amazing. We asked for this and it's here now, and this is important, and this is how it's changed our population. This is how it's shifted the culture and stigma in our states. And so I hope that they realize that this is an empowering report and what they have to say is important, and we're listening.
Any final thoughts, Jenny?
No, I mean, I would just like to mirror that what Kim said about we all have a voice, and the individuals that come to the playing field, they are amazing about advocating for change and trying to find these, round pegs that fit into a square box solutions sometimes, thinking really outside of the box for all of our state. And I also would just like to say that, we're here to listen. We're here to support them if they want to participate in this. They can find us on the behavioral health website and under the Idaho Behavioral Health Planning Council. And the more consumer voice that we have, I think the more the stories are heard and the more effect that it has. People are captured by, real life things that happen to other individuals. And I think that that's something that's really important for individuals that are consumers or family members of consumers to know.
Awesome. Thank you so much for being here and kind of sharing this information on this podcast. It's going out to everyone who needs to hear this. So thank you.
Thank you.
Thank you for having us.
Yes, thank you.